Hello, my name is Lavinia Heffernan, and today we are talking to you about the webinar for phone interpreting. And today I am on Yugambeh country in south of Brisbane, in the Beenleigh region and Logan region. So I'm talking to you from Yugambeh country, and I'd like to acknowledge them as the traditional owners of land on which I am presenting today. As a Luritja Pintupi woman from Central Australia, I am a guest on their country, so thanking them for allowing me to present on their land. I'll handball it over to Anna and Lauren to introduce what country they're sitting on.
I am on the Wallumattagal land. I'm not far from the city of Sydney, and I live on the river, Parramatta River.
And I'm based here on Boonwurrung country by the sea in Melbourne.
Fantastic. So, like I said, my name is Lavinia. I'm also known as Anya. You can call me Anya. I am a Pintupi-Luritja woman, and I'm also one of the Indigenous Project Officers with the NAATI team. I'm originally from an Aboriginal community called Popanya, which is 3 hours west of Alice Springs. And in the photo, there's a picture of myself and my mum on the top, back home on country about a year ago. I'll handball it over to Anya number 2. So there's 2 of us presenting today. So Anya lul pinyurangari inquiry wajalko. So Anya, nyuntol piwanka.
Dziękuję, Lavinia. Ja mam na imię Ania, pochodzę z Polski, w Warszawie się wychowałam, chodziłam tam do szkoły, na uniwersytet i przyjechałam do Australii 30 lat temu. Now you must be wondering, what did she just say? I was speaking Polish, and I wonder what the Polish language sounds to your ear, but basically what I said is that I grew up in Poland. When it was under communism, I moved to Australia 30 years ago, and I studied English when I lived in Poland. I started to study English when I was 12 years old, and I fell in love with the language. And then I ended up falling in love with an Australian man, and that's how I ended up in Australia. I work for the Healthcare Interpreter Service in Western Sydney, and I started there as a Polish interpreter 28 years ago, and for the last 14 years or so, I've mainly worked in education for the Healthcare Interpreter Service, but also for Onsite, which is the Professional Association for Spoken Languages in Australia, and for a couple of universities. So I'm here because I've learned a few things about phone interpreting through my own practice, through discussions with other interpreters, and lots of workshopping. Over to Lauren now, I think.
Excellent. So my name's Lauren Campbell. I work at NAATI in the Indigenous Interpreting Project as well. So I've been here for the last couple of years, and I did used to work at AIS based in Darwin before. And we are really keen to pull together some professional development training for Aboriginal and Torres Strait Islander interpreters that also includes tapping into people like Anya, Polish Anya, and so we can all share our experiences and learn together.
So we have Anya from Popanya, and we have the Polish Anya.
It all rhymes nicely.
That's right. So a little bit about NAATI, and why we're running this professional development as a webinar. So NAATI is a national certification body for translators and interpreters, and we run certification testing so that people know that if they work with NAATI, that they're certified and they can be trusted, and interpreters have the interpreters are strong interpreters. And we do this testing across all the languages, whether you're from Poland to Mexico, so all the international languages, migrant languages, as well as Auslan. So Auslan is like the hand sign language. We require NAATI interpreters now to recertify to show that they're maintaining the languages and the language is still going strong. The Indigenous interpreting team support the Aboriginal and Torres Strait Islanders to interpreters to become certified and stay certified. And so we run these sessions to help, anybody that wants to redo their recertification and redo their training and yeah, it's part of our requirement. So we have Anna along as a guest to make sure that these PDs are here for you guys to maintain that recertification. So, like we said earlier, we're talking about phone interpreting. It is becoming more and more popular and a little bit more on demand lately, especially with all the lockdown that's been happening across Australia. And services are wanting us to be on demand a lot more, especially places like Centrelink, who, you know, like to ring on the spot. And it's a lot more accessible and it's cheaper for services and clients, and yes, makes it easier for clients to, you know, access the phone. And so for that reason, we have this session. Anna, do you have anything else to add around what's happening over in Sydney?
I have to say that where I work, the way we do interpreting has changed dramatically since about February last year. So at the beginning of last year, we probably did about somewhere around 90% of our interpreting jobs on site, and only about 10% or around 10% are over the telephone, and no video whatsoever. And now in September 2021, we do the exact reverse. So we do more than 90% of our jobs remotely, mostly over the phone still, but we're also doing some video appointments to support telehealth, and less than 10% of on-site appointments. So it's just changed completely. And in the last 18 months or so, I have done 3 on-site training sessions, and the rest has always been via MS Teams or Zoom. So our business has just changed completely.
Yeah, and that's same with my end. I feel like that job's increased, just doing it over the phone rather than, you know, face to face interpreting as well. But also, as part of our CPI training to get to be certified interpreters, we are now adding in that phone component because of, I guess, increased demand, as well as you know, because we do a lot of phone interpreting as well. So to have those skills is really important.
Absolutely, and it wasn't part of the old testing system. So it is a new part that's there to reflect what it means to work in the industry these days. So they are skills that, yeah, we're now testing candidates on when they're going for their NAATI.
Yeah.
I sat for my test in 1993, and I was certainly not tested on phone interpreting.
Yeah, and I sat on mine maybe 10 years ago. Doesn't feel that long ago. But I didn't sit through a phone testing either.
But it is now part of the industry. So I think it's good that
Yeah.
this is now part of.
Absolutely. And I guess it's really important for our interpreters to recertify and have these skills behind them, because, you know, we are now doing more of these phone interpretings, and for our mob to be skilled and know when to queue in and when not to queue in are skills that are so valuable out on the field to today. It's so relevant.
Yep, absolutely. So that's why we thought this topic is a good one for those of you who have done the PPI for NAATI and so probably missed out on this training. Everybody's learning new skills as we go along. So this is an opportunity to pick up on that.
So we know, if we say that not everyone prefers it, I mean, not everyone prefers telephone interpreting, that's an understatement generally. When you talk to interpreters, they would generally say that prefer on-site interpreting. I think most of us do. I've got some results of a study done across Australia in 2018 when they surveyed 465 interpreters across the whole of Australia, and 58% of those interpreters said that they preferred on-site interpreting. There were 15% who said they preferred telephone, which is interesting, and the rest said it depends, or they like both. They sort of sat on the fence. I think interpreters are now getting more and more used to telephone interpreting, so I think the statistic could be slightly different these days, because phone interpreting does have some advantages, and the more we do it, the more we realise how well it can work in many settings. It's definitely more efficient for simple jobs. So the conversations that generally can be done over the telephone easily can also be very efficiently interpreted over the telephone. Some interpreters say that one of the big advantages of phone interpreting for them is that they get to focus more on the language itself, on the messages that their clients are exchanging, and a bit less on people. Because when we are face-to-face on-site with our clients, sometimes we might run into ethical dilemmas. They're trying to tell us their life stories and try us to advocate, they get to us to advocate for them, whereas over the telephone, they have the remote access to the interpreter, so we can focus on the message rather than on the interaction between people. And it offers us great flexibility, and I think we can all relate to that now. I can certainly relate to the fact that working over the phone via video gives me a lot more flexibility. I can work anywhere. I could connect with interpreters across Australia in my training sessions, and I can also be easily reached if somebody needs a Polish phone interpreter, particularly in the medical setting. We have no travel expenses, and it's a lot safer for us at the moment because we're not exposed to the infectious clients, which is really important during the pandemic. So certainly there are advantages there.
Yeah, definitely. And I guess going on that, Anya, us as interpreters at it with our own mob, how often do we get asked to, oh, because you interpreted for me, you helped me, I can help you back. So, what kind of phone jobs have you done that makes it a little bit more, I guess, easier when what is it easier for you to interpret over the phone than to see face to face, so that those ethical standards aren't being broken or breached, and that we are as interpreters remaining neutral? And how often do you do your interpreting on phone, and what do you like about interpreting? What are some of the positives and perks that you've mentioned, Anya? Like you said, it's a lot more safer. It keeps us safe from COVID-19. And what are some of the challenges that you might face? Maybe challenges for the phone might be that, it's a bit distorted. You can't hear them talking on the other side because, maybe the line is really bad, or there's a footy match going on, or the kids are running wild in the background, which would be most likely my situation. And then what don't you like about phone interpreting? And sometimes it's really awkward because you feel like you're talking to yourself, or you kind of feel a bit uncomfortable and awkward, or maybe it's the audio. Maybe you can't hear clearly in what's been communicated or what's been said by the people on the other end. So we'll give you guys a few minutes to sit down and have a bit of a brainstorm, and you can press pause at this stage and write down some of your thoughts. Yeah.
We won't do thinking music, just press pause and then we'll continue.
So, what are we doing today? What are we going to talk about? We are very soon going to watch a video which gives you an example of a phone interpreting situation. We are going to talk about different challenges that come with telephone interpreting. And of course, we're going to also talk about strategies, how to manage them, because that's the most important part of education, is the strategies that we learn about how to handle difficult situations. Lauren and Lavinia have developed a best practice checklist for you. So we will walk through that checklist, and we will do some exercises to practice the strategy. So we've got different scenarios and role plays for you throughout the session. And at the end of the session, we hope that you will feel more confident to set up phone jobs well, and that you will be familiar with good techniques for managing interaction over the telephone. In our live session, interpreters also had the chance to work with other interpreters and meet each other. Working alone with our video today, we hope that you will have an opportunity to reflect on your experience with telephone interpreting.
And have a chat to any other interpreters you're in contact with.
Yeah.
And we're about to watch a phone interpreting video. This video was produced by the organisation where I work, the Healthcare Interpreter Service in Western Sydney. And you are going to see a telephone interpreting job. You can see in this picture here a lady who is lying on the bed. She has a cardiac condition. She is a Croatian speaker. And the doctor is seeing her today because they're recommending a bypass operation for her. So the doctor runs through what a bypass is and what are the risks and why she should have this surgery. You will see Željka, our Croatian interpreter, who's sitting in the office at the Healthcare Interpreter Service, and she will be interpreting this communication. This video was made to train interpreters on how to work over the telephone and also to train service providers on how to work with interpreters over the telephone. So you will see two different lots of commentary, and I hope it makes sense because you will see a speaker coming every now and again giving some tips for interpreters, how to interpret on the phone, and you will also see the same speaker coming and giving some tips for service providers on how to work with interpreters. While you're watching the video, we would like to ask you to reflect on the challenges you're seeing in this video and also on the strategies that the interpreter uses. So hopefully you've got a piece of paper and a pen with you, and remember, if you don't, you can pause and go and get them and write some notes about what you have seen in terms of the challenges and strategies for the interpreter. So let's play the video.
Okay. This is also available on YouTube, as you can see.
Hello, Dr. Roberts speaking.
Hi, I'm Katica.
I will be interpreting for you today.
Hello, Katica. I'd like you to interpret for Mrs. Horvath here. We've performed an angiogram on her today, and I'm about to give the results.
Okay.
Phone interpreting is a quick and cost-effective way of accessing an interpreter. In this situation, Katica is providing phone interpreting for Dr. Roberts' meeting with cardiology patient Mrs. Horvath.
Dr. Roberts?
Can you please pass the phone to the patient?
Sorry.
Molim.
Alo, ja sam Katica. Ja ću vam tumačiti danas. Prevešću vam sve što doktor kaže i prevešću doktoru sve što vi kažete.
Doktor je danas izveo koronarografiju na vama i sad vam treba dati rezultate. Svake puta kad ja završim sa tumačenjem, vi trebate dodati telefon doktoru.
A kada on završi govoriti, on će vama dodati telefon.
Dobro.
Before the phone assignment where possible, interpreters should ask for a briefing with a health professional to establish the context. They should ensure the privacy of the communication, have a notepad and pen ready for note-taking, introduce themselves and explain their role to the clients and ensure that everyone can hear and understand each other.
Gospođo Horvat?
Molim vas dodajte telefon doktoru.
Right. Mrs. Horvath, how are you feeling today?
Molim,
Gospođo Horvat, kako se osjećate danas?
ne osjećam se dobro. Boli me u prsima i teško dišem i jako se brinem.
Gospođo Horvat?
Molim vas dodajte telefon doktoru.
Oprostite, izvolite.
Yes, Katica?
Dr. Roberts,
It is difficult to keep the flow of conversation going this way.
I think it would be better if you use the speakerphone.
Well, just a moment. I haven't used this before. Can you hear me?
Yes, clearly.
Excellent. Can you ask the patient if she's okay this way?
Gospođo Horvat, čujete li me dobro ovako?
Da, čujem vas.
Yes, she's fine with this. Now, in response to how she's feeling,
She said, I don't feel very well. I have chest pain.
I struggle with breathing I'm very, very worried.
Although I interpret in the first person generally, sometimes in these situations I resort to interpreting in third person. Otherwise, it is just too confusing for the patient over the telephone.
Mrs. Horvath, the results of your tests show that you have a blockage in the coronary artery. As you can see here, there's a narrowing of the artery that supplies blood to the heart.
Excuse me, doctor, if you don't mind.
Yes, Katita?
Because you appear to be showing something I can't see, I can only repeat what is said, but I cannot refer to the actual image.
Sorry. I have an angiogram in my hand. It shows a picture of the arteries. The artery wall has thickened where I'm pointing my finger, which is restricting the supply of blood to the heart.
Okay, if you don't mind, I'll explain this to the patient.
It would be good for you to keep your finger pointing to the relevant place while I interpret.
Sure.
And doctor will then say, look here now. And I have no idea what they are looking at because I'm on the telephone not looking at anything.
Je li to ozbiljno?
Is this serious?
Yes, it's very serious because the blockage is quite substantial. You can see here that the artery wall has thickened. This restricts the flow of blood to the heart. A clot can form, blocking the artery and causing a heart attack.
Da, veoma je ozbiljno, jer arterija je prilično začepljena. Može se stvoriti ugrušak, začepiti arteriju I tako prouzrokovati srčani udar.
A da li je potrebna operacija?
Does that mean that I need surgery?
Yes, I'm coming to that. Please be calm. I'll tell you what we're proposing to do.
Da, sad ćemo o tome. Samo se smirite. Objasnit ću vam što namjeravamo napraviti.
Pokušat ću.
Try.
A clot like this could ultimately cause death, so we need to perform an artery bypass.
Ovaj ugrušak krvi bi u krajnjem slučaju mogao uzrokovati smrt.
Da bismo to spriječili, trebamo napraviti operaciju
Kako mi
bypassa.
možete reći da se smirim, a sad ste mi rekli da mogu umrijeti?
How can you ask me to calm down when you just told me that I could die?
Well, it's very serious, but an artery bypass should fix the problem.
Da, ovo je veoma ozbiljno, ali operacija bypassa bi trebala riješiti problem.
A šta znači bypass?
What's a bypass?
Katita, you're a health interpreter. Can you explain it to Mrs. Horvath?
I'm sorry, doctor. I can only repeat what you say.
The actual explanation needs to come from you.
Fine. A bypass is when we take a healthy blood vessel from another part of your body. We then use the blood vessel to build a detour around the blockage in the coronary artery. The surgeon will access your heart either by cutting down the length of your breastbone.
Phone interpreting requires interpreters to take notes because people tend to speak longer when an interpreter is not present.
Or cutting underneath the left
I'm
ventricle.
sorry, doctor. Can you just let me interpret because it is a long and complex explanation. Operacija bypassa se izvodi tako što se iz nekog drugog dijela vašeg tijela uzme zdrava krvna žila. Ta se krvna žila onda koristi da se napravi zaobilaznica oko začepljenog dijela vaše srčane arterije.
Da li može se dogoditi da operacija ne uspije?
Oprostite, gospođo Horvath, samo trenutak. Dopustite mi da završim sa tumačenjem I onda ću vaše pitanje prenijeti doktoru.
Often they also cut in. Then I have to say, please let me interpret the whole passage, otherwise the translation will not be complete. Then I can interpret the question.
Dr. Roberts,
Mrs. Horvath asked if there is a possibility of failure with this surgery.
Well, like any operation, there are risks. They include possible hemorrhage, infection of the wound, heartbeat irregularity, kidney failure.
During phone interviews, healthcare providers should use a speaker telephone or a dual handset and sit close to the microphone. They should sit facing the patient and maintain eye contact. They should speak directly to the patient as you would in a face-to-face interview, and pause frequently to allow information to be taken in by the interpreter and passed on to the patient. Healthcare providers should compensate for the lack of visual cues by explaining to the interpreter what is happening.
We've performed this operation successfully hundreds of times. Please don't worry.
Ali gospođo Horvath, mi smo ovu operaciju uspješno izveli već stotinama puta. Molim vas, nemojte se brinuti.
Pokušat ću da se ne brinem. Ne bi baš htjela da ja budem ta koja će pokvariti vaš odličan rekord.
So we're back. I hope you enjoyed the video and that as you were watching it, you paid attention to what made the session difficult for the interpreter, what sort of challenges did she come across. And she did have some strategies to deal with these challenges because we're trying to teach interpreters with this video how to work over the phone. So we are offering some strategies there as well. So at this point, I would like you to pause this video, this session, and reflect on what you have seen, perhaps take some notes on a piece of paper. And when you're ready, when you've taken all the notes that you can on this topic, play the video again, the session, and we will show you what other interpreters have mentioned in terms of the challenges and strategies.
Okay, so when we ran this session the other week, we came up with a few. Let's see if they'll appear. So people, noted that there were pictures being used that the interpreter couldn't see, the angiogram that came out. This doctor was playing the part of a troublesome professional quite well, wasn't he?
Yeah.
So yeah, we saw that the interpreter came in, very confidently to ask him to explain the visual and hold his finger at the point on the picture, which was really helpful. People also raised that issue at the start about the passing the phone back and forth that clearly didn't work. But Kartitsa was onto that one, was giving them advice straight away, making them put it on speakerphone. There were some pretty long and complex passages that the doctor said, like really intense, actually. I hope he doesn't really do that.
It did make me stop and think, especially when they said, can you explain what bypass is? And, culturally, we've got to be able to think about that Western term and then be able to interpret on the spot. If we're not prepared, we need to be able to think of ways on how we can explain a lot of that into our first languages. And sometimes the challenges are that those Western terms need to be thought through a little bit more.
It's interesting because this very scenario happened to a colleague of mine who interprets in the Arabic language. We were sitting at the office side by side, and my colleague was interpreting a similar kind of exchange where the word bypass came up, and the client clearly didn't know what it meant, even though my colleague used it correctly in the Arabic language. And then the doctor said to him, when obviously the patient says, "Well, what's a bypass?" So this is interpreted from Arabic into English. What's a bypass? And the doctor says to my colleague, "Well, you are a healthcare interpreter. Just go ahead and explain to the patient what a bypass is." And he used a really good strategy, and this is what Katita does here. Rather than explaining what it is, saying to the doctor, "Could you please explain it in simple terms, and I will interpret your explanation." So then we don't have to worry about any of that.
And that is so important, especially when we're out on the job as interpreters. The professional might say to you, "Well, can you put in your bit?" And it's happened when I've gone face to face, when I went and did a mental health one, Anya, and it's really important that we are not afraid to tell the professional. We as Arnangus, we as Aboriginal people, are not afraid to tell Karia and Lindra mob that they can put it back on them to explain what that means for you to then only interpret what's been said.
Absolutely. Yeah, and the other interpreters in the session also raised that there was no briefing, and we certainly encourage interpreters to get in there with confidence to say, "Can you give me a briefing on what we're going to be talking about?" So they could have identified bypass earlier, and like you say, Lavinia, have a think about how you're going to say that in language.
Absolutely. And that is so critical, so important. You don't want to say something that's, you don't understand and put in an English term hoping that it's been understood, and seen that happen so many times. So it is very important as us as Anangu people going in to do this interpreting job to make sure that we are briefed and we know what we're going to be talking about, and that we've thought through those Western terms on how we can sort of culturalize it and indigenize it. That's a fancy word, for them to understand and for us to then transfer that meaning across to the best meaning-based interpreting.
It's really interesting 'cause in migrant languages, there will often be just one word that we'll use in you know, if it's a bypass in English, we'll use one word in Polish or Arabic, whatever it is. But you've got some additional considerations about, as you said, indigenizing some of the terms.
Or like you say, Anna, like from this, if this was a real story, you know, your average person doesn't really necessarily know what a bypass is unless it's happened to them or their relative, maybe.
An average medical interpreter knows what it is because we sort of live that stuff on a daily basis. But that's when it becomes so dangerous, because we start to think that we sort of, you know, they say bush lawyers in Australia that I'm a bush doctor and I can start explaining these sorts of terms. So we have to hold ourselves back. I do know what a bypass is. I can probably do a good job, but you, the doctor, you can do a much better job explaining this to the patient.
But sometimes they don't. That's the scary
thing.
Yeah.
And there are some other terms when we sometimes think we know and we could explain, but we could be really misleading the person because our understanding is not quite right.
Anya, I mentioned earlier that I did a job for a mental health professional, and I remember them. This was actually face to face, so that's the difference. And they'd asked me for my opinion on whether this client had mental health issues, and I had to then say, well, that's not my job to determine that. I can only interpret what the interpreter's saying, and probably give you a cultural perspective. So, and that's as far as my role will be to work with alongside the doctor. And you know, don't be afraid to say that. And you know, it's important that we as interpreters stand firm and stick to our ethics and our code of, you know, what we're there to do.
I think it would be really interesting to do an interpreting in mental health session together.
Could be a bit dangerous.
Just some of the other things that came up, we saw that Katitsa use really good note taking and cutting in to cope with the doctor going on, but also the patient jumping in. She was a bit of a superstar, I thought, at managing all of that.
Absolutely. And that interaction management is so important when we are working alongside professionals and our clients, and making sure that we know when to ask them to stop and when to cut in, and when, you know, we need to be able to manage that and not be afraid to manage that as well.
Some things that these days, 5 years on, we will do slightly differently about the video. We will certainly make the briefing part of things more prominent. We will also get the interpreter to wear headphones, which we didn't back into the 2016 because we didn't think enough, we didn't have enough experience. But on the other hand, there are other things that I really like about the video, and that's the interactional management aspect, because we try to show quite a realistic session. And yeah, we crammed quite a few different challenges for the interpreter into one session. But I think generally that works better than showing the best practice session when nothing goes wrong, because people don't learn quite as much from that. Because how can they learn about interactional management if the interpreter in the video didn't have to manage any of the interaction?
Yeah, good example. Okay.
So some of the challenges that you did see in the video, just to recap, is challenges with the technology. So sometimes it's about the poor sound quality, poor connection, but other times it is about inappropriate equipment. So what the inappropriate equipment that we saw in the video was the phone passing, which is the worst case scenario. I'm not sure how often it happens these days. It did happen to me in my practice. I was interpreting for an older gentleman over the telephone, and I would interpret what what the doctor said to him into Polish, and then the guy would say in Polish what he had to say. And then he wouldn't pass the phone back to the doctor. And I repeatedly asked him, can you please pass the phone back so I can interpret what you just said for the doctor? And he didn't get it. I don't know how many times I had to ask him. And I thought, this is really odd. I'm sure this has just happened to me, but in workshopping, I learned from my colleagues that it used to happen to them an awful lot. So that's why we included it in this video. And Katica, the interpreter, asked him to switch to the speakerphone, which can be done on most phones these days. And this is a really good solution to use the microphone or to use the speakerphone, so that we don't have to put up with the patient hogging the phone for too long and not passing it on to the doctor or to the other service provider that you're working with. The other issues could be background noise. Sometimes when there is a lot of background noise, the speaker is not the best option. So I've heard interpreters in other workshops saying that when they were working in a very noisy environment, or their clients were in a very noisy environment, they were in the same place the clients were, like the doctor and the patient that you just saw in the video, that the interpreter actually suggested turn the speaker off and start passing the phone, because in that way we will cut out some of the background noise. So there could be different, there isn't one size fits all kind of situation here. We all need to adapt to different situations. Of course, when the signal drops out, when there is a crackly speaker, delay, echo, all sorts of things, these might not be necessarily things that we can do something about, and they might have to try and call us again at another time. So in terms of strategies, three-way conversation is the best. Speakerphone sometimes is the best. Headphones for the interpreter, always. That's why even when I talk to my parents in Poland on Skype, I put these on because it's become a habit. And finding the places where there is good reception and use a good phone. Lavinia, you wanted to
Yeah, I do. I wanted to add in there. I actually, on my very first day of interpreting, I was getting assessed, and the phone, the booth wasn't working. So I actually had a soundproof booth, and I had earphones. And of course, the phone line wasn't working. So I had to improvise and think on the spot of ways to manage this conversation and this job. And of course, I started sweating and getting a little bit flustered. And so I was like, can you call me back on this number? It's a direct line to our office. So we went and readjusted it so we could put it on loudspeaker and talk to the loudspeaker. And they couldn't hear me through their loudspeaker, so then I had to pass the phone across to the lady that I was talking to and the Centrelink worker, and it was the most challenging and the most scariest way to start a journey, my interpreting journey. I was sweating, but I passed, and I was told that I did very good interactional management at that time, but I tell you what, it didn't feel like it, and I was shaking, and it's so it's normal to be a little bit panicked and a little bit spooked about the situation if things aren't going right. But whatever works will work, whether it's crackling, the noise in the background. We as interpreters have to be flexible and open to any situation that comes at you, and just work with what you have.
That's it, ready to problem solve.
Yeah, ready to problem solve on the spot.
Now, the other kind of challenges with speakers, sometimes we might have our clients might be individuals who are hard to communicate with, and that can happen on either side. It won't always be the Indigenous client. Sometimes it will be the English speaker, the service provider, that we have difficulty understanding. So some of the clients could be hard of hearing, elderly, and I know that Lavinia has a comment to make on this. There could be also clients with heavy accents, that could be on the service provider side. So for example, I have a Polish accent. You might have a service provider with a very heavy Polish accent, and you might have difficulty following what they're saying, or whatever accent it might be. And in mental health consultations, it's very hard to do many of them over the telephone. And that generally is because some mental health conditions affect the way the person is thinking to the degree where their speech is disturbed. And their speech, when it's very disturbed, it is hard to follow, hard to make sense out of. And it means that we might have to interpret on a very literal level and interpret simultaneously, which can't be done over the telephone. So some of the mental health consultations are pretty much mission impossible over the telephone and might have to be rescheduled as on-site appointments whenever possible. But Lavinia, what about the hard of hearing?
Yeah, so as many of our mob know and very much well aware, sometimes we have that glue ear as kids growing up in community, which then infects our inside of our ears to then make it hard for us to hear when we're much older. And so, you know, we need to be mindful when we're speaking to our mob that, you know, sometimes they might not have very good hearing and might not be able to hear. And you're absolutely right, Anya. Like with the accent, I know that we've got many doctors that come through the Alice Springs Hospital with many nationalities, and sometimes it is harder to hear them speak English than it is to then, you know, try and interpret that across into language. And especially those who have like a monotone in their speaking, and you trying to understand what they're saying, and you become sort of so lost in what's been communicated. So don't be afraid to stop it if you need to stop it, and make sure you do brief, and make sure you have that you know, sometimes I feel like we as Arangos, as Yappas, that we sometimes sort of pull back and get a little bit nervous and don't want to continue. So don't be afraid to intervene when you need to, and ask the doctor to repeat more clearly in a way that you understand. Maybe a word that you don't understand that they've said, ask them to say it in another way.
It's so difficult because sometimes you have to ask with an accent, you have to ask for repetition many times, and that can happen on site, but it's worse over the telephone. I remember working for one doctor on site, and I could not understand what he was saying a lot of the time. And then we had a chat with other interpreters working at the same hospital. We all had the same problem, and we would repeatedly ask for repetition. And in the end, you know, after a few repetitions, you still don't understand what he's saying. I think we just went along with what we could understand, which of course is not a good way, but there's no good solution sometimes when you repeatedly ask for repetition and you still don't know what the person is saying, especially when it's from the professional side.
And is it all right to ask them to write it out on a piece of paper and then, or maybe even verbalize, spell it out what they're saying so that you could spell the word out so you can visually see it as they're speaking?
Yeah, absolutely, because it's important that we get the communication right. It's just so embarrassing when we have to do it with a professional who you know, I'm sure they're aware of what the difficulty might be for us though. So in terms of strategies, I know interpreters do say that with some appointments, they suggest switching to on-site face-to-face, and with some appointments, it is possible. But with many, particularly in the current climate, it is not possible to reschedule them. So we have to keep trying and trying to make it possible. But if we do find ourselves interpreting for a psychotic client, for example, who has a disturbance of thought, and we really can't follow what they're saying, and it really has to be interpreted simultaneously, then don't be afraid to insist and let the professional know what your difficulty is, and they will have to reschedule with an on-site interpreter. Now with the checkup,
Sorry, I just thought of something else as you were talking along about hard of hearing. Lauren, I know that you've had a lot of dealings with our mob, you know, in past, and, you know, lived with our people. Well, not lived with our people, but close enough. You know, we come across a lot of our mob that have chewed plenty of tobaccos and pidgeries and what we call mingurba back home, or the hand sign mingurba, and sometimes it causes a bit of decay and loss of teeth, and so when
It's true,
people
there's a lot of
speak,
mumblers out there.
mumbling and sort of that sort of problem with the understanding and hearing that. So we as interpreters need to make sure that if we're one of those people, that we need to be clear when we speak as well as interpreters, so that our clients can hear us and be able to communicate that. And if it's our client that you can't understand for those reasons, you know, don't be afraid to ask them to repeat it if you didn't fully understand. It's better to get the right and accurate message across than to make it up as you go along.
And if the client has difficulty hearing, it might be a matter of putting the phone to the right ear if they're holding the phone. It would make all the difference. Like on site, you sometimes might have to be mindful which side you're sitting on, so that you're sitting next to the good ear, and similar with the telephone. We might move along with the challenges. challenges with content, which is a very important part of the communication and the interpreting job. And you saw an example of this in the video when the visual cues are important. So in the video, you witnessed a situation when the doctor was referring to an angiogram scan and was showing the scan to the patient, so he didn't have to use the language that was quite as visual because they were all looking at the same image, but the interpreter didn't have access to that. So to her, it wasn't making a lot of sense at that time. So she asked him to pause. But generally with the communication over the telephone, when we can't see people, it is harder to manage that communication because we can't see from their body language when it's appropriate to cut in. And also they can't see us. So they don't know that we're ready to start interpreting because they can't see us. And Lavinia, you wanted to say something?
I just got nervous when I saw that bit where he was pointing to the diagram and she was interpreting what was being said, and I guess not knowing whether he's pointing at the spot that you're interpreting is the correct spot, and my body just froze of fear.
Absolutely.
In that particular scene.
And when you imagine a different sort of interaction, when they might be using a piece of equipment, so the service provider is teaching the Indigenous client how to use a piece of equipment, and sometimes they don't even tell us what that equipment is. They will just say it. So let's have a look at it, and they get into it, and we don't even know what it is. And they're saying, so it's a press here and turn over here, and we can't visualize it. So it's very important to ask, could you please explain and describe what it is that you are looking at, what piece of equipment are we dealing with, because otherwise it's so hard to make sense out of it. And if it's hard for us to make sense out of it, our interpretation that will not make a lot of sense to the client. But generally, we're looking at a little graph here that says that 55% of the communication comes from the visuals, from what it looks like. So with phone interpreting, we haven't got access to what it looks like. So we're tuning often very instinctively into what it sounds like, because that's 38% of the communication. So the tone that the person is using, the words that are emphasizing, the speed with which they talk, that carries a lot of information as well. So it's important to listen attentively and also to convey that tone in your interpretation. And the words apparently only account for 7% of the communication. So it's an interesting study.
Wow.
And of course, it's going to be harder for us when you can't see the facial expressions, the body movements. So that's about the visuals. But the other aspect of the slide that we're looking at, and challenges with content, is about some of the settings that are not appropriate for telephone interpreting. And we've already mentioned one of them, and that is mental health setting. Not all the consultations, some consultations even in the mental health setting could run smoothly, but many of them might not be appropriate for the phone for the reasons that we've already talked about. Sessions with highly emotional content, very sensitive kind of settings could be difficult over the telephone, but also group settings with courts, tribunals, group meetings of all different sorts involving a number of people, and we might not even know who is present to start with, and they all start talking over the top of each other. There's definitely difficult to manage even face-to-face, but even more so over the telephone. And long sessions such as trials, very difficult over the phone. So again, some of them maybe could be scheduled to an on-site appointment, but in a lot of them we'll have to learn to manage the communication effectively to enable that session to go ahead, even though it's not ideal. And what's coming up next?
Sort of brings a bit of fear into me when I think about some of the things that you need to interpret without looking on the spot, and you know how 55% is body language and 38% is voice and tone. And I think about the cultural implications back home and on, you know, sometimes our voices and our tone, we've got to be careful in how we communicate, because it can be misunderstood and seen as being more aggressive and so forth. So you know, I guess, these are the things that we need to be culturally mindful of as well.
Okay, so we're up to the challenges with interaction, which is the hardest kind of challenge with telephone interpreting. And a lot of it comes from the fact that clients are not familiar with our role as the interpreter. They don't know how we work, what our ethics is, how to work with us, and that a large part of our challenges in phone interpreting comes just from that. So that's why with the video that you saw, we attempting to train service providers on how to work with interpreters over the telephone, because if they are well prepared, it will make the session a lot easier for us. So if they don't know what we require to do a good job, they will not necessarily give us a briefing. They won't do any introductions, and these are very important aspects of an interpreting job. We do need to coordinate talk more over the telephone, and it's particularly hard when it's about group settings. So one of my friends, actually an interpreting colleague, was interpreting in a session that was quite difficult because it was over the telephone and involved a client who was suffering from dementia. And she was interpreting what the service provider was saying. And at one point, the service provider says to the interpreter, "Does the client understand what I'm saying?" And as an interpreter, how can we say whether the client understands what we're saying? We can say, "I've interpreted everything accurately," but we can't say whether they understood it or not. And that goes to show that the service provider doesn't always understand what the interpreter does. And it also is an example of a service provider who is not that great at communicating, because it is their job to try and check and make sure that the client understands.
They haven't learned that teach back method very well.
Exactly, exactly. That's exactly what I'm thinking of. But you have heard us mention interactional management a few times in the session already, and now we would like to focus on it a little bit more. You might have noticed some examples of interactional management in the Healthcare Interpreter Service video. So the question to you is, what do we mean by interactional management? What are we talking about? It's quite a fancy term. What does it really mean? And what can you, when you're thinking about the video, what are some of the examples that you might have seen or noticed in the video or in your own practice as an interpreter? What are we talking about? And do we want everyone to pause at this stage and have a little think before going to the next slide? Lauren?
Sure. Yeah, have a little bit of thinking time.
So some of the strategies while you're thinking for dealing with the clients who don't understand how to work with interpreters are to explain our role at the beginning, what your role as the interpreter is, to ask for briefing if they haven't offered. Even if you're in front of the client already, you can still have that briefing, but you will need to interpret that to into the client's language also. You can ask who is present if there is a whole group of people, and be ready to actively manage that interaction. So what do we mean by managing interaction?
Yeah, just made me think a bit more on, we are the expert interpreters. That's our role. We need to make sure that we hold accountability to ask these questions, to debrief before we go into these jobs. And sometimes I feel like our mob, we sometimes might get a little bit intimidated by some of the professionals, especially lawyers. Lawyers are the most intimidating. And remember, not all lawyers speak more than one language. Just remember that.
Absolutely. I just wanted to share the next slide, which comes from the materials we've been using to train interpreters who are wanting to sit their CPI test, their NAATI certification test. And this little tree diagram is the skills that are assessed as part of those role plays now. And there's the key English and language skills and meaning transfer, all the stuff about accuracy and doing it in the consecutive mode, one after the other. But then there's this other branch of the tree that is called managing interaction or interactional management skills. And that's all this stuff, a little bit of the traffic cop stuff, directing the parties. So the band 1 descriptor, like the highest level when we're assessing those tests, interpreters who show that they skillfully manage the interaction between the two speakers, the English and the language speaker. They handle any problems really well and smoothly, like efficiently, politely, and at the right time. And like Anna says, it's really difficult because you can't see when is a good time to jump in, but being able to sense it by paying particular attention to the sound of their voice, the intonation, the natural pause, and using those moments to jump in, or jumping in straight after there's been a big word that you didn't understand. So it's at a good time, but not going as far as to overmanage things and interrupting the whole time.
So here are some of the examples when and how interpreters have managed the interaction from that study that I was talking about earlier. Let's have a quick look at the examples and to explain a little bit more what we're talking about here. So interpreters explicitly manage the interaction, for example, by asking for a briefing, which we're strongly encouraging you to do. Don't be shy. Asking clients to identify themselves when they don't know who is talking and it's not making any sense. By explaining your role as an interpreter, because of those people who don't know how to work with us, to check whether everyone can hear and whether the connection is still there. To seek repetition, remember those clients with heavy accents, asking for explanation or clarification sometimes when we have difficulty following what people are saying or when a big term comes up and we just don't know what it means. But we also manage turn taking when clients talk non-stop or very fast or over the top of each other. It is within our right to ask them to pause, slow down, and allow us to interpret. Sometimes we might have to alert everyone to communication problems when parties don't understand each other, or to suggest switch to on-site interpreting on rare occasions. Now, interpreters also have reported doing the following things in the red on the right-hand side, such as bringing conversations to the point. So if the client is going off track and giving us stories that are not related to the question, interpreters sometimes ask the client to stick to the point. But you'd have to ask yourself, is this the role of the interpreter? I'd personally say no, unfortunately, we have to go along with that long story and interpret that into the other language until the person who's listening interrupts and perhaps says, no, I don't want to know about that. That's not the question that I asked, which then we interpret into that language. I know that sometimes interpreters take it upon themselves to calm the non-English speaking clients. I do have a question mark over whether this is the role of the interpreter, but I have heard one interpreter describing a situation when the client was very stressed even before they started, and the interpreter had to sort of calm her down to even get off the ground by, to get the session going, just to say who he was, and then he was going to interpret for her the whole time, and if she didn't understand something, she could ask questions, so in that manner. But generally, again, it's up to the service provider to calm the non-English speakers. Sometimes interpreters also elaborate, explain, paraphrase, or do some adaptation when the understanding is compromised. I know that there might be some cultural aspects in your setting that you might have to do it to some degree. But if there is a terminology problem like with bypass, it's much better for the service provider to do the explaining and paraphrasing rather than the interpreter attempting that. And sometimes interpreters try to act as an intermediator, which is, I guess, not a great thing to do either. And
sorry, I just wanted to go in there and Anya, before you go off to the next bit, this has a name to it, which through a researcher, but this is also very important culturally as well. So when you're going in to do those asking of those briefings, we've got to remember the cultural complications around poison relationships and things like that, to make sure that you are going in and that you to the job through the phone, that it's okay to have that conversation or whether it's not okay. So who is the person on the line? So that's really important culturally, but also to debrief and make sure that the language is the right language. Just because you speak Central Aranda does not mean you bring in a Western Aranda to come in and do the interpreting, or because you speak Pintupi-Luritja, you bring in a Yankunytjatjara speaker to come in, or Southern Luritja speaker to come in and do the language. You need to make sure that the language is the right language to that client. And also very important for us as Anangu, as Aboriginal people, to explain our role in that, we're not there to help, that we're there as mutual parties, that, we're not on anybody's side, that, we're purely there to interpret two ways, and, make sure that it's accurate as well. So, yeah, so just a couple of things in there, and also making sure that our tone that I mentioned earlier isn't going to be misunderstood and backfires on us, and it's understood.
They're just looking at the slide and listening to what Lavinia just said. We could run an ethics session probably just based on this slide.
Definitely, especially when a lot of people are used to working in roles that are kind of liaison roles and needing to advocate. It certainly muddies the waters a little bit bringing this into it. And that's why we do focus in the ethics training on when you got your interpreter hat on, stick to that role. Yeah.
And I think this is the last aspect, the last challenging aspect that we would like to mention before we have a short break, is the personal challenges for the interpreter of particularly phone interpreting, being mental or physical challenges. So when you work on the phone a lot, you are more likely to suffer from stress and feel isolated than when you're working on the ground with people. And this has been established via research into phone interpreting. Interpreters do say that they feel isolated and stressed and sometimes even burnt out when they work on the phone a lot. It is harder because there are no colleagues around, and it's harder because you can't necessarily prepare yourself mentally for the setting, because your phone calls could be all over the place and for a number of different organizations within one day. So it's harder to prepare yourself for all of those different settings. And particularly if the jobs are close together and there are many of them in one day, you could suffer burnout. So some of the strategies to help you cope with this is debriefing. You can ask the service provider even on the telephone for a debrief, or you could debrief with your agency or some of the colleagues that you might connect with on a regular basis. Make sure that you take breaks, and the physical breaks are just important as a break for your mind, because when you're sitting at a desk or sitting in a booth, your posture might not be that great. It might not be 100%, and you need to get up regularly and stretch because you get stiff. And the other aspect of this is self-care and counseling, and this is also a topic for another session, to think about how do you look after yourself? Do you look after yourself enough? Are you taking breaks regularly? Are you taking some time to distress? Do you have good self-care strategies? How do you look after yourself? Do you go for help somewhere when things go really bad? Do you know where to turn for help if you needed that in terms of managing stress?
Yeah, sometimes we face some really hard topics when we do our jobs as interpreters, and sometimes we need to be mindful of that sort of vicarious trauma, and what we hear can sometimes then impact us as interpreters, or might be a trigger for us. So we need to be mindful that we are taking those self-care steps, and that we are using those strategies within our own workplace, or while we're isolated as well, that there's people that you can talk to, or like you said, Anya, is go for those walks and, get out of your chair, do those star jumps, or run around for a bit.
Or take a tea break.
Or
And
cup of tea break.
we're going to take a cup of tea now, and we're going to press stop on this recording. This has covered all the challenges that we've grouped and identified as part of phone interpreting. And in the next recording, we're going to be talking through the best practice checklist and going right through that timeline from the beginning of job right through to the end. So go have a cup of tea and a stretch and do some star jumps. You ladies too.
All right, so back in 5 minutes.